One of the top priorities of the Bill and Melinda Gates Foundation is to support efforts to control and eradicate malaria. The disease occurs in nearly 100 countries worldwide, impacting both the health and the economy in sub-Saharan Africa and South Asia. More than 200 million people suffered from the disease in 2010, leading to more than 500,000 deaths that year alone. The vast majority of malaria victims are young children under the age of 5. So the question is, what more can be done in the fight against malaria? Joining me now to discuss the latest efforts being made in the field and in the lab are Dr. Jessie Stone. She's the founder and director of Soft Power Health, an NGO dedicated to fighting malaria and based in Uganda. Also with us is Bruce Hay. He's a professor of biology at the California Institute of Technology, and his research focuses on innovative ways to eliminate mosquito-borne diseases like malaria. Welcome to Full Frame. Jessie, let me start with you, because I think you've got a really unique human story about all of this. Somehow you got involved in this it was sort of serendipity, wasn't it?
Absolutely. I had no interest initially in malaria per se, but I was invited on a kayaking trip to the Nile River back in 2003. And while I was there, 2 of the people I was on this expedition with got malaria, and I had to treat them. And looking at their situation, and they had been theoretically taking prophylaxis and sleeping under mosquito nets, and they still got malaria, made me look around and say, well, what about the local people? You know, do they have malaria all the time? Do they have mosquito nets? What do they do about this problem?
And you were shocked at the answers.
I was completely shocked at the answers. I mean, we did a little survey in the village we were staying in. We went to 50 homes and interviewed 50 home residents, and they did not understand, not a single one of them understood that malaria was caused by the bite of a mosquito. And so therefore, if they didn't understand that, why would they need a mosquito net? So nobody had a mosquito net.
Bruce, we're talking about one continent, but we also talked about Asia, and I want to get your own personal observations, because your wife's from China. How does that influence your work and your drive to actually make a significant dent in all of this?
Well, malaria is a worldwide problem. It's not only present in Africa, but also throughout large parts of Asia and India as well. And so it's something that we think about all the time in terms of how can we stop this problem and what can we do that is new, because as we've heard from your introduction, the problem is, despite all of the things that we normally do with drying out the environment to remove the mosquitoes, to try and remove the mosquitoes, the drugs, the bed nets, etc., we still have this huge burden throughout the world.
Let me ask you about your work, because I think it's really interesting, and it seems like it's cutting edge, and it's approaching it from a different angle in a way, isn't it? Can you talk about it?
So our focus is the mosquito, and again, it comes from the central observation that malaria is caused by the bite of a female mosquito, picking up a blood meal from one infected person, incubating and growing those parasites for a period of days, and then transmitting it through a bite again to an uninfected person. And the fundamental cause of malaria is the fact that we have those mosquitoes and we can't get rid of them in the places where malaria is endemic. And so our work starts from the observation by others many decades ago that some mosquitoes are naturally resistant to malaria. The genes, the variants of the genes that are naturally occurring mosquito genes that encode these genes that make the mosquito resistant to Plasmodium have been cloned. And what's been found is that if you take those and you reintroduce them into a susceptible mosquito, that mosquito now is no longer able to carry Plasmodium from one person to another.
And so, from a scientific standpoint, that's all fascinating, but to somebody like Jessie, who's boots on the ground, what he just said is that's hope, in a way, for you, right?
Absolutely. I mean, absolutely. I think the thing about malaria, everybody wants a simple answer. You do this, you're going to eliminate malaria. But it's an incredibly complex problem, and you have to deal with it on many fronts. The mosquito is definitely one of the fronts that you have to deal with, but you also have to deal with, for example, the reservoir for the disease, which is us humans, you know, and how How can you control it in the humans as well? How can you control the environment that people live in? You know, that's when you come back to things like having people sleep under bed nets, making sure they get the proper treatment. There's also something called indoor residual spraying, which has been done in a number of places where they literally come into people's homes and spray insecticide on the walls of people's homes to eliminate the resting mosquitoes that are there to bite you at nighttime when you're sleeping.
You know what's interesting, talking to Bill Gates, you know, in that conversation, he talks about things like toilets and thermoses. You're talking about mosquitoes, working with the mosquitoes. It seems to me like we have a new generation of people attacking this problem by coming in with a different set of values or approaches. And I want to talk to you about that. Got two young people here who are very aggressive about this. What do you bring to the table? What do people like Bill Gates bring to the table in terms of going after malaria, and yourself as well?
Well, I mean, I think, you know, one of the things Gates has been focused on for a very long time, and it's very ambitious, and it would be absolutely fabulous if it actually works one day, is developing a vaccine. There's been a lot of money and effort and research that's gone into that, and the vaccine that has been developed to date is not very effective. It's not something that you could ever roll out on its own. It would have to be done in conjunction with something else. We still have to focus on the most important issue in my mind, which is educating people about how they get malaria and how they can prevent it. That is something that we still take for granted and think that in many of these rural communities, in the areas, for example, where we work, that people understand how malaria is transmitted, but they don't. They don't. They do not have that information. So getting that information to people helps people help themselves.
Bruce, she's talking about vaccination. It seems like this has been something that people have been going at for a long time. Why the difficulties?
The difficulty is that Plasmodium, as a parasite, is very clever about having multiple strategies for evading the human immune system. And so what I'm sure Jessie sees all the time is that people who are continually exposed to malaria build up a low-grade immunity to it that makes them not have necessarily severe symptoms all the time, but they're always carrying the parasites. And when the parasites infect young children, of course, they don't have any immunity, and so they can get a very severe form of the disease. But the bottom line is that the parasite is very, very good at evading the immune system.
Bruce, Jessie, thank you both so much. It's been a great conversation. Really enjoyed it.
Thank you.